Hi, my name is Ellen. My pronouns are she, her, and I'm a mental health nurse.
What is a mental health nurse?
A mental health nurse is someone who is a registered nurse who's gone on to do further studies to specialise in mental health. People can come and see a mental health nurse for heaps of different reasons. You can find mental health nurses in hospitals, on wards, in community centres, in clinics and in specialty areas. So you can find them in a lot more places than maybe you think you would. So mental health nurses can look after people from infant right up to adult spaces. I myself work in child and adolescent spaces, so I've worked with people as young as 4 or 5 right up to 18.
What can I expect if my child sees a mental health nurse?
You can expect lots of questions when you first come and meet a mental health nurse, because primarily we really want to get to know you and work with you as best as we can. You ultimately are the expert, and we need to know more about you so we can help identify your strengths as well as identify the areas that need a little bit of help. When you come and see me, you'll find that I'll ask lots of questions personally about you, but one of the biggest things that I like to do is check in with you regularly, make sure you're feeling comfortable, ensuring that we're not asking something that's too much of you right now. I really like to focus on what makes you feel good, what you might be struggling with, who are your biggest supports, who do you need further support with, and just really try and understand more about you so I can help alongside you figure out what we can do to make life a little bit easier. So people come and see me for a number of reasons. That can include struggling with anxiety, with depression, questioning gender identity, struggling with disordered eating, which may also include eating disorders. So when we gather all of that information, we work with you or your child. We can come together collaboratively with a plan that's going to help navigate the next stages of care and help you get to where you want to be. People can also be seen by a mental health nurse if they have illnesses such as bipolar and schizophrenia. So it's a really wide variety of reasons why you might meet with a mental health nurse.
How can we access a mental health nurse?
Your best bet to access a mental health nurse is through your GP. A GP or a general practitioner is a wonderful first port of call for any help in life, but a GP can really get you linked into the spaces that you need to. And from there, if they think that a mental health nurse in a specialty area or in a community team or in a hospital might be really useful for you, they can make that referral for you. And generally speaking, as mental health nurses tend to be funded by the government, there'd be no out-of-pocket cost to you.
Are there common misconceptions about mental health nurses?
So there are many common misconceptions about mental health nurses. I think the main one is where you find them. Most people probably assume a mental health nurse can only work in a hospital on a mental health unit and generally just going around dealing out medications to make people feel better, when that's really not the case. And we also provide therapy, which is something that is also a big misconception when it comes to nursing care. We get an opportunity to train in different modalities of treatment. I'm trained in family-based treatment, cognitive behavioural therapy, and that means I'm able to provide those sorts of therapies to young people who need them.
How can I get the most out of my visit to a mental health nurse?
To make the most out of your time of meeting with a mental health nurse, it would be really wonderful if you can be as open-minded as possible, have lots of questions to ask us as well, because we shouldn't just be the ones asking the questions. If you want to get to know your mental health nurse a little bit better, it's a really good way of just asking them questions to begin with. I'm a really big fan of lists. So if you know you're going to see someone, especially in the medical field, writing things down can be a really useful way of making sure that you don't miss anything when you first meet with a practitioner or a mental health nurse. Making a list of things that you would like to talk about, things that you don't want to talk about, things that are really important to you can make it really easy for that first meeting with a mental health nurse.
A final word.
If you come and see a mental health nurse like me, you can be assured that your physical health, your mental health, and all the different layers that make up your identity will be taken into consideration. Personally, I feel it's really important to recognise the other parts of identity that make up a person, including race, gender, sexuality, and able-bodiedness. And all of these things can really have a wide impact on your overall well-being. And as a mental health nurse, from a holistic approach, we can really take that all into consideration to make sure that you get the best treatment possible for what you need.